Have you ever dreamt you had no teeth and woke up in a panic? Do you know someone who's pregnant, smokes, or has diabetes? If neither of these questions apply to you, let me ask you this. Do you or someone you know have teeth? Then listen up. As a former dental assistant, my goal today is to express the need of taking care of our teeth through proper brushing and flossing techniques. I will be explaining what our mouths consist of, why it's important to keep them clean, and how to do so using the tools available to us. So what are our mouths made of? The visual or clinical part of your tooth is covered in enamel. This material is prone to dental caries or cavities. Our teeth are held into our jawbone or alveolar bone by the periodontal ligament, a soft tissue fiber that runs the length of the root of the tooth. Think about the ligaments that keep your joints attached. Then the bone is covered by a soft tissue called gingiva or your gums. Plaque is a creamy byproduct of more than 700 species of bacteria found in one's mouth, as found in a 2005 study by the Harvard School of Dental Medicine and the Department of Molecular Genetics. Calculus, which is commonly known as tartar, is calcified or hardened plaque. When it develops supragingivally, it can lead to dental caries. When it develops subgingivally, it can lead to periodontitis, a disease of the supporting tissues. Periodontitis has many levels of severity, beginning with gingivitis, the inflammation of soft tissue. In this model, we see on this side of the tooth healthy gums. On this side of the tooth, we see gingivitis, the inflammation of gum, and when probed or when flossing, can bleed. These succeeding teeth show early, moderate, and advanced periodontitis. As calculus develops supragingivally and migrates underneath the gum level, bone diminishes and exposes more of the tooth and increases mobility. So why should we keep our mouths clean? Those who don't keep healthy flossing and brushing habits are at a higher risk for cardiovascular disease and respiratory infections, according to Bird and Robinson, authors of Modern Dental Assisting 8th edition. In addition, pregnant mothers are also at a high risk for delivering preterm low birth weight babies. As a surgical assistant for a periodontal office, we often treated patients who were diagnosed with periodontal disease. In addition, I volunteered several years for a dental charity where we would spend all day extracting unhealthy teeth. In both scenarios, we had patients who didn't want to lose any of their teeth, and some patients who couldn't have cared less, opting for the option of completely removing their teeth and replacing it with a removable denture or a fixed denture attached to dental implants. Let me caution against the optional easy fix of removing teeth. According to a 2012 study done by the Dental School of Oeste de Santa Catarina University in Brazil, the chewing ability caused by the decrease in the number of natural teeth produces a significant and negative impact over quality of life. Dental implants and dentures require upkeep just like teeth do, and both cost more in the long run compared to just taking care of our teeth from day to day. Mostly, oral hygiene offers and maintains self-confidence and allows us to use our teeth as they were intended. In this book, entitled Tooth by Tooth, a nonfiction children's book written by Sarah Levine, we see an illustration of human dentition by T.S. Spooky Tooth. Generally speaking, Humans have 4 teeth on the top and the bottom called incisors, and those teeth are meant for biting. In the corners of our mouths, we have our canines that are meant for tearing. And depending on how old you are, you'll have several molars in the back of your teeth, the back of your mouth, that are meant for chewing. So how do we keep our teeth clean? Creating healthy brushing and flossing habits can take time, but the act itself is quite simple. Take your toothbrush and angle the bristles at a 45-degree angle into your gingiva. Then create small circles with your bristles, moving slowly and softly across each tooth. This should take 2 minutes every morning and evening. Flossing is most effective when placed between each tooth, brought up and over the arch of each tooth, as far as it will go, down, and then on the other side of the papilla, the peak of gum between each tooth. A note to parents, please help your children with this. During my time as a pediatric dental assistant, I saw so many children who hated their teeth being cleaned and hated the dentist due to the pain of a lack of flossing and subsequent gingivitis. There is a joke in the dental field that the most ideal age to stop brushing our children's teeth for them is the age of 18. Begin by making their appointments after they cut their first teeth, because even though these appointments won't last long and seem perhaps a little silly, it will help them acclimate to regular dental visits. Lastly, there are many products that allow our efforts to go a long way. A fluoridated toothpaste, for example, will help prevent dental caries in both adults and children's teeth, depending on the age of our children. And Gum Brand offers an expanding floss that expands when it becomes wet and is able to wick more plaque. Now that we've come to understand the importance of why we brush our teeth, what our mouths are made of, and how to develop healthy oral hygiene habits, I want you to close your eyes. Give me your biggest smile from ear to ear. Feel peace and love enter your heart and your mind. Now imagine your family doing the same thing. Your wife or husband, each of your children, mom and dad, your brothers and your sisters. Heavenly Father has given us the tools to take care of ourselves and the responsibility as individuals and as parents to make sure that our teeth and supporting tissues are healthy, and that the same can be said of our children. Thank you.